I have the possibility and the honor to talk to Mr. Andrew Hopkinson today. He will talk to us about a new method for amnion membranes which don't have to be applied in a theater and with no stitches. Please enlighten us. What is new about it?
Thank you very much. So amniotic membrane is being used in ophthalmology for over 80 years. Traditionally, the membrane as a human tissue is stored at -80 degrees. This presents several challenges. First of all, -80 degrees cold chain logistics is very challenging to distribute across the globe, and customers don't have -80 storage in their facility. Second of all, the preservation process itself compromises the tissue. And although amnion works, the freezing process strips out really important natural heating properties of amnion. Recognising this, over the last 18 years, my team and I at the University of Nottingham have overhauled the way that we process amnion to remove the need for cryopreservation. And what we do is we delicately preserve the tissue using low temperature vacuum evaporation, which results in an amnion that's stable at room temperature. It can be shipped and stored at room temperature, and that makes the tissue available at points of care. That transforms the way that amnion can be used, because conventionally amnion is used as a last resort in theatre because of the need to apply surgically. But what we've been able to do is remove the need for surgery and actually take this into a clinic because it is available in the clinic. And we've developed various different ways of applying amniotic membrane in an outpatient setting. Foremost, we've developed OmniLenz, which is a bandaged contact lens, which has been specially modified, and that allows us to take the lens out of the bottle, place a piece of amnion in the lens, and then apply that in a very simple 4 to 6 minute procedure.
Are there any other diagnoses which might be suitable and where the treatment might be helpful for, except, ulcerations? Other diagnoses?
Yeah, absolutely. Historically, amnion is being used, as I said, in the late stage, so it's chronic disease. By being able to apply it in a clinic, you can intervene much earlier, much more effective, and this opens up the scope to treat many more patients with a broadening number of etiologies that would never have been considered by amniotic membrane transplantation, but would benefit from the tissue transplantation.
For example?
Okay, for example, so conventionally it's chronic epithelial defects. Suddenly now you can treat persistent epithelial defects in an acute stage. It opens the scope to treat inflammatory diseases such as dry eye disease, and even move into the preventative therapy and stabilization therapy strategies, such as prior to cataract procedures, for glaucoma patients who suffer from dry eye disease as a result of their medication, and even beyond there. So we're just opening the door and seeing what happens, but the actual scope is quite significant.
What I found interesting when we met to discuss this issue is that you can cut the amnion membrane in a size which is suitable to the patient.
Sure, I mean, we produce the membrane in a variety of different sizes to try and minimize waste, but corneal defects are not a standard size. And what you're able to do prior to the application is just simply cut it with scissors, place it over the defect, measure it exactly, and when you're ready to use it, you just apply the tissue straight onto the eye, dry, and that allows rapid and effective in vivo rehydration.
Thank you very much for this very interesting information, and all the best for you.
Thank you.
Thank you.